My name is Deja Netz, student PT. This is Shelly Mink, student PT. We're doing an interview techniques video about scenario number 1. Patient has a femur fracture, had a internal fixation, and is now at a skilled nursing facility. Here we go. Are you Shelly?
Yes.
My name is Deja. I'm a student PT. Deja Netz, student PT. And I was wondering if I could ask you some questions about why you're here at the skilled nursing facility.
Oh, honey, sure.
So I was looking through your chart, and I see that you're here because you had a surgery on your leg.
Mm-hmm.
And I was wondering if you could just give me some details of what happened.
Well, so I was at home and I was going outside to check the mail, and then I heard the phone ringing, so I was running back to try to get inside quick because my grandson was calling, and I can't miss a phone call from my grandson. He's adorable. So I was running back into the house. Well, whatever you might see me as running. I'm 80. So I was walking briskly, and I tripped and fell, and next thing I know, I had this awful pain my neighbor saw, and she came over and asked me if I was okay, and I told her that my leg was hurting really bad, so she called the ambulance to come and pick me up.
Okay, and was there something that you tripped on, or you just kind of stumbled?
I don't know, I think I was just moving really fast, and I was walking through the grass, and I just caught my foot.
Okay, and do you remember what happened at the hospital?
And it all happened quickly, but when I got there, I know they ran some tests and took an x-ray, and then they told me that they were going to have to do surgery, and so I ended up having the surgery there, and that's about as much as I remember.
Okay, I did see the x-ray in the chart review. And how long ago was this?
It was about 5 weeks ago.
About 5 weeks ago? Okay. And so I was wondering, what is difficult for you now that this has happened? I know that you're at this facility, at the skilled nursing facility, but if you were back at home, what would you have difficulty with?
Well, right now I can't stand for a long amount of time, so I'm worried about that because when I go into the restroom, I can only take a couple of steps and then I have to sit down, and so that's concerning. And just walking is really hard for me.
Okay.
It hurts really bad.
Okay. What sort of things would be your normal activities at home?
I normally wake up and I'll make breakfast, so I cook myself some meals throughout the day, and then just cleaning up around the house or watching television. And on Sundays I go to the church and I volunteer, or every now and then I go out for lunch with some friends. But for the most part I'm at home and I just clean or do some yard work.
Okay. And you mentioned pain, and I wanted to ask you a little bit about that. For right now, if you were to put your pain on a scale of 0 to 10, 0 being absolutely nothing, and 10 being you're back at the emergency room, could you put your pain on a scale?
I would probably say it's about a 4 right now.
About a 4. And does your pain ever get better than a 4?
Not really. It gets worse, but not really better.
Okay. And how much worse does it get? What is your the most?
When I'm at the most, it's probably about an 8, and that's usually when I'm standing in the morning to brush my hair in the bathroom or trying to go to the toilet.
Okay, and what kind of things is there anything that make it better, and what makes it worse?
And then it feels better when I'm lying down and I just kind of prop it up on some pillows. But the worst is just when I have to get up to do anything. I have to get up to go to the restroom, and I usually dread that.
Okay, so being on it for longer periods of time is when the pain is worse.
Right.
Okay. Are you taking any kind of medication for pain?
I take the Tylenol. I don't really take the other stronger medications. I try to just work with the Tylenol if I can.
Okay, and then are you taking any medication for anything else?
I take some other medications. I gave a list to the doctor when they came. My son helped write them down for them because I know they wanted to know.
Okay.
And so as far as I know, I'm not sure about any new medications that they put on there, but I know that I gave them a list of the ones they had.
Okay, I'll double check for that. So do you work?
I do not work. I'm retired. I just do some volunteer work at the church.
Okay. And are you in charge of any other activity like childcare, or I know you mentioned housework?
No, I mean, my grandson comes over every now and then, but his parents come, so I don't have to really do any childcare.
Okay. Or do you have any other things that would be relevant in your past medical history, like histories of other things that have happened to you?
I haven't ever had anything like this happen. I've just, the only things that I've ever had trouble with is just my blood pressure, and that runs in my family, so
Okay.
kind of expected that, but I usually monitor it with medication or just eating better.
Okay. And you said that you haven't had any surgeries before. Is that correct?
No surgeries.
Okay. Have you had prior hospitalizations or any falls before this?
One time I had pneumonia for a little bit, and I was in the hospital for a little bit for that.
Okay. And any falls before this?
No, sometimes I feel unstable if I'm moving too quickly, which I was this time. No, I'll feel like I'm gonna fall, but I haven't had any where I've actually lost my balance and fell like this.
Okay. And I wanted to ask you also about your house. Do you live in a house, an apartment?
I live in a house.
Okay. And do you live with someone?
I don't. I live alone.
Okay. Do you have any steps or stairs to enter your house?
I do. I have 3.
Okay. Do you use any kind of assistive devices at home? Glasses, canes, walkers?
No cane or walker. I do wear glasses for reading.
Okay. Do you have a hearing aid or anything like that?
No, I haven't had any problems with my hearing.
Okay.
At least I don't think so.
Okay. And so before this happened, what kind of did you have an exercise routine or anything that you were doing for physical activity?
I mean, besides the yard work usually is my exercise. I walk around and just kind of pull some weeds out of the yard, and have a garden where I can grow a few vegetables. But
Okay.
I don't really do any walking or things like that. I should, but I don't.
Okay. Have you had physical therapy ever before in your life?
I have not.
Okay. And before this happened to you, were you able to sort of take care of yourself, dress yourself, any of the activities in your daily life that you needed help with?
No, I was doing it all on my own. I'd like to go back to that.
Okay. And so what is difficult for you? I know you said standing for prolonged periods and walking. Is there anything else that we have missed?
Other than that, right now I just feel kind of helpless because I need help with everything to get my clothes on and everything.
Sure.
Wherein it's a big change from where I was before.
Okay. And so I just wanted to ask you, we're almost finished, but I just wanted to ask you about any other bodily symptoms that you have trouble with. Do you have any trouble with your skin, heart, or lungs?
No, just my blood pressure problem.
Blood pressure?
My skin a little
Do you
bit
have
more
any-
saggy than it was before.
Any
But-
open wounds or anything?
No.
Okay. Do you have any hearing problems?
No.
Okay. Bowel or bladder problems? Okay. Anything like endocrine problems, that would be like anything with your pancreas, diabetes, parathyroid, hormone, anything that you've ever heard of like that?
No.
The doctors mentioned. Okay. I was just wondering how to
What's
check
a
for all
what?
parathyroid. So it's just basically any hormonal problems.
No, no.
Okay. All right. So what's going to happen is we're going to take some basic measurements of your leg and see what we can do to help you out.
Okay.
All right. And what is your goal for therapy? That's the other thing I wanted to ask.
I'd like to be able to go back home and live on my own again. I don't want to have help. Although my family's there, I don't want to have to ask them for help.
Okay. And so the doctor said it would be at least a couple of weeks, so we have a little bit of a time frame to work within.
Okay.
All right. Sounds good. So that's the end of our video. Thank you very much.